Hi, I'm Simon King and I want to show you today a much better way of testing the Gluteus Maximus muscle, the largest muscle in the body, named of course after the famous Roman gladiator. Now, if you've been taught to do the Glut Max test, you've probably been taught in the Kendall and Kendall fashion or the AK fashion, where the leg is lifted up and you push down on here. Now sadly this does not show very many of the genuine Glut Max weaknesses. So this is often a false negative. And the reason this is important is that the Glut Max is what stabilizes us as we lift things. So any pressure on the extensors with lifting, the Glut Max not only takes the leg into extension, but it stabilizes the pelvis so that we can stand up. Because if that Glut Max is inhibited, then we fail to stand up properly. All of the stress of this has to be taken by the small muscles and joints of the lumbar spine, and this is when we get disc problems and disc herniations. And we know this because this is the typical posture of a low back case, and we know that the minus sign mean they walk up their thighs like this, and this is just a failure of Glut Max activation. Also, what we know is that when we do the Faber test, we're testing the motion of the Glut Max, the one that's inhibited. Now Faber is badly named because we're not actually doing flexion external rotation abduction. The test is extension external rotation abduction. So it should be called the Exaber test, not Faber. A much better way to test this is to do a physiologic motion. So the problem with the AK version is that this action is not physiologic. We would never use this in our daily life. We would, however, use a walking pace or a running pace, and to do that, to test it then in a physiologic action, you keep the knee straight. You lift the leg up into extension, you use the foot pointed, you take your contact over the ball of the foot, and the patient pushes up, and you measure the amount of force they're providing and make sure that force can sustain itself for at least a couple of seconds. So we do the other side, lift up. What you don't do is push the leg down without really feeling for what's happening. So you don't do this, push up, you don't just do that. You wait and you feel for the muscle to engage, you hold it, you feel whether the muscle's engaging and getting stronger, preferably that it's pushing you away, and then that's the strong test. Now very occasionally you can make the test even harder by taking the leg out to the side into abduction as well, and then have them go straight up to the ceiling. This is a tougher test, but for an athlete or a younger person, this is, well actually, if anybody can't do this, it does show that the muscle is inhibited.
Now let's have a look at how this works in real time.
Lift your right leg high in the air, push it up, now go. And the left one high, push it up, go. Yeah. Right one, so right glutes are good, left glutes out to lunge. In the air, push it up. Lift the left one high in the air, push it up. You can feel that switched on now, can't you? Lift your whole right leg high in the air, push it up, go. Left leg high in the air, push it up. Right leg up, the whole thing straight up, push it up. The whole left leg in the air, and push it up. Push up. In the air, straight, push it up, go. The left leg high in the air, push it up hard, go. Push it up hard, go. Now lift your right leg high with your toes. Now push up against me, go. Now I can lean as much weight as I want on that now. Lift this leg high, push it up hard, go. I can really go to town on that, and you can hold me. In the air, push it up. Left leg high in the air, push it up. Keeping your toe pointed, lift the whole right leg in the air. Push up against me now with your foot.
Oh my god.
The left leg in the air.
Oh, I can't lift this.
Right.
Oh.
So push up again.
I can't lift the last thing
No,
now.
you can't. Lift this leg as high as it'll go. And push your toes up against me, go. Yeah. Yeah, I know it's sore, but you could do it. You did it against me.
High in the air, push it up high. And the left leg high in the air, push it up.
So this is one of the advances in muscle testing that is part and parcel of the afferent input muscle testing course. And if you'd like more information about that, enter your name and email on this page, and be happy to send you some other testing and get you up to speed on the theory behind it and the whole paradigm of examining for afferent input problems. So look forward to seeing you next time for the next video.